Hello, everyone. My name is Michelle Robinson, and I'm with the National Council of Juvenile and Family Court Judges, and welcome to the Vision 21 Linking Systems of Care for Children and Youth webinar on the Defending Childhood Initiative, done in partnership with the Office for Victims of Crime. Before we begin, I'll provide you with a brief overview of how our webinar system works and how you can interact with today's presenters. Visual feedback is a way you can quickly interact with the presenters of today's webinar. At the top of the screen, you'll find a button resembling a person holding up their hand, and to the right of that is an arrow. By clicking the arrow, you can see a list of options for providing visual feedback. You can ask the presenter to speak louder or slower or indicate that you agree or disagree. The chat box is to the right of the file box. You'll see in this window, you'll be able to send messages to the other participants in the webinar. Chat entered into the Everyone tab will be recorded and posted as part of the recording of this webinar. To chat, simply type your message into the white field at the bottom of the window and press Enter on your keyboard or click the button to the right to send. Our staff will be monitoring the chat box for questions, so if you have questions for the presenters, please enter them into the chat pod, and our presenter will answer your questions as time permits. If you have technical difficulties during this webinar, or you have questions about one of our interactive features, please send a private message and we will help you address those issues. Thank you for your attention while I explain the features of our webinar system. At this time, I'll turn the presentation over to Lama and Rachel to introduce themselves and begin our webinar.
Great. Thank you so much for having us. We're really excited to be here with you electronically today. My name is Rachel Swanner, and I'm with my colleague Lama Hassoun Ayub. We're with an organization called the Center for Court Innovation, which is based in New York City. Our organization does a lot of criminal justice reform, programming and practice, and policy work, and research, and technical assistance. So we're members of the research department here, and we were the organization that was funded to evaluate the Defending Childhood demonstration project that was funded by the Department of Justice in 2010. So let me tell you a little bit more about the Defending Childhood demonstration program. So in 2010, the Office of Juvenile Justice and Delinquency Prevention funded 8 sites around the country to address children's exposure to violence in their community. So what the original funding was about a 9-month planning period where the sites were asked to do a community needs assessment and put together a strategic plan on how they would address things that they found from the needs assessment related to children's exposure to violence. So the map here that you see is the 8 sites. We have Multnomah County in Oregon, so the big city there is Portland, Oregon. We have Rocky Boys Reservation in Montana, where the Chippewa Cree tribe is located. The Rosebud Sioux tribe in Rosebud in South Dakota. Grand Forks, North Dakota. Shelby County, Tennessee, which the big city there is Memphis. Cuyahoga County in Ohio, and the big city there is Cleveland. Boston, Massachusetts, and Portland, Maine. So you might notice that some of the pins on the map are red and some are blue. So all 8 sites were provided funding for this initiative to implement their strategic plans that they had designed in the phase 1 of Defending Childhood. And in phase 2, the sites were given different levels of funding, and the red pins were the sites that were chosen to be a part of the evaluation. So when we're talking today about some of the findings and lessons learned from our evaluation, we're really focusing on those 6 sites that have the red pins. So the official goals of the Defending Childhood initiative were threefold. 1 was to prevent children's exposure to violence. 2, to mitigate the negative impact of such exposure when it does occur. And 3, develop knowledge and spread awareness about children's exposure to violence. And as I said, we were the cross-site evaluators for this demonstration program. We were tasked with doing 2 things. One was a process evaluation and one was an outcome evaluation. So in the process evaluation, we sought to document all of the different things that the sites were doing, all the different strategies that they chose, and we'll talk a little bit more about those strategies, challenges to implementation, the infrastructure of how things were implemented, some things about staffing, challenges to recruitment, lessons learned, what worked really well that might be replicated somewhere else. And in order to do this, we implemented 3 strategies. The first was we went out to each site multiple times and conducted interviews. I should also say, so this started, the original funding for the planning process started in October 2010, and then in September and October 2011 was when sites were provided funding to implement their plans. Okay. So our process evaluation and our outcome evaluation captures the time period from that start of implementation in the fall of 2011 through the fall of 2014. So the second component of our process evaluation was just reviewing different planning documents, their needs assessment, their plans, to determine this is what they said they were going to be interested in doing, and here's what they did, and how did that change over time. Looking at different meeting minutes, different materials that they gave out to the community, training materials. And then the final thing was that we collected implementation reports on a quarterly basis. So every few months, the sites would document everything that they did. So all of their different activities, all of their different collaborative body meetings, how many people attended, what was the topic, if they went and spoke at a city council meeting to promote the initiative, who was the audience, what did they talk about, how many trainings did they offer, to really capture the dose and the reach of the program. The second major component of our evaluation was the outcome evaluation. And this too had 3 components. One was we conducted a baseline and follow-up community survey to determine changes in baseline and as well as changes in attitudes about violence, knowledge and awareness about local resources, violence exposure for adults. It was a survey of 18 and over, but we did ask parents of children who were 18 and under about their child's violence exposure in the past year as well. The second, to kind of evaluate some of the professional training activities that happened, was we administered a pre and post survey of those who went through a Defending Childhood training. And then finally, we looked at core community level indicators, so different levels of violence in the community collected from police data, court data, certain large community surveys such as the YRBS, the Youth Risk Behavior Survey. So we looked at different levels of violence in the community. Now, I just want to stop and say that violence means different things to different communities. So some communities had higher levels of community violence and gang violence and shootings, and some had more higher levels of domestic violence, and others, for instance, in Grand Forks County in North Dakota, they didn't have the levels of community violence that, say, Cleveland or Boston had, but they did focus their programming on violence that was classified as bullying or teen dating violence, so something that was maybe more of an issue for them than community violence. So different types of violence throughout the different communities. So in order to address these different types of violence, sites chose various strategies. And this is Rachel speaking, in a little while Lama is going to talk through some information of what we've learned about the collaborative bodies, but each site was tasked with putting together a collaborative body of different stakeholders in the community to develop a specific plan to address children's exposure to violence. And the sites, those collaborative bodies together based on results from the needs assessment and existing resources in the community and wanting to leverage existing resources and fill gaps where there were gaps, chose different strategies to address children's exposure to violence. The strategies fell into these categories that you see listed here on this slide: prevention, screening and assessment, case management, treatment and healing, community awareness and education, professional training, system infrastructure change. So I'm going to talk a little bit more about each one of those, and then we're going to go more in depth into just a few of those that might be more relevant to the programming that you guys are designing at the moment. So the prevention strategies had the goal of preventing children's exposure to violence and in the different communities. And the prevention, the type of violence, as I said, that varied in different places. So some sites had programming that focused on anti-bullying or addressing teen dating violence, and other sites had prevention programming focusing on violence in the community. There were two different types of strategies, types of prevention strategies. The first was universal prevention, which was often school-based, which meant that it wasn't targeted based on people's past exposure to violence or potential risk for exposure to violence. It was, let's blanket the community with prevention programming. So for instance, in Grand Forks, North Dakota, they were able to partner with the Grand Forks public school system, as well as some of the other school districts in the rural areas of Grand Forks, to have different prevention programming from kindergarten through 12th grade offered in the school during the day. So that was considered universal prevention programming because it wasn't based on risk level. It was everybody in the school got this programming. And then other sites chose targeted prevention programming for at-risk populations or neighborhoods. So perhaps a neighborhood at a high concentration of violence, and that site might have funded a local community organization to implement a prevention programming in that community. The reach for the universal prevention programmings was obviously much larger because everybody in the school was getting it, as opposed to the targeted prevention programmings where you might be concentrating your resources on populations that may be highly at risk for violence exposure, but your reach might not be as much. So some of those programs might enroll 20 students per cycle, as opposed to the universal prevention where you might have a whole school. The second strategy was screening and assessment. So when we talk about screening and assessment, we talk about using various tools to identify children who have been exposed to violence and determine what services are appropriate for them. If they are to gauge levels of trauma symptoms, because some people have been exposed to violence but may not be displaying trauma symptoms, and to use the screening tool to kind of triage folks into who might need treatment immediately, and then connect them with a place that can assess them. And maybe the screener is meant to be kind of a quick, and I'm going to talk a little bit more about this in a minute, kind of a quick diagnostic tool to kind of say this person has been exposed to violence and is displaying trauma symptoms and needs a full assessment. Then the full assessment is when you go through with the young person a series of different questions to really gauge what their needs might be and connect them to appropriate treatment and healing programs. So the treatment and healing programs are the interventions designed to address that exposure and to heal the trauma from being exposed to violence. Some of the sites chose case management strategies. So really more of, if somebody was referred to them for having been exposed to violence, working with them to assess their needs and connect them and refer to them to appropriate services. A lot of times these were referring to counseling services. Sometimes it was referring to other services that maybe are indirectly related to exposure and trauma, but are still part of the needs of that young children. And a lot of these often related to issues surrounding poverty. Okay, so next we're going to talk about community awareness and education. So all of the sites wanted to raise awareness about violence and violence exposure, the impacts of having been exposed to violence in their communities, and chose different strategies to do so. So there were multiple types of community awareness campaigns. Some were focused on just letting people know about the Defending Childhood initiative and what the purpose of it was, and who to call, and what services that they could provide. And then other campaigns were around letting people know this is a form of violence, or X is a form of violence, or Y is a type of violence, and we don't want violence in our community. So there were different types of campaigns. There were one site chose to do a web series that was youth written and youth led and youth produced to address different issues that young people face, specifically around violence. Other sites did various smaller scale campaigns that had, youth designing posters and writing poetry and music about violence in the community. And others had other campaigns creating PSAs, public service announcements, that focused on positive behaviors in the community that they wanted to see. So not just here's what violence is, but here's what we want our community to look like. Then another one of the strategies that sites chose, so most of the sites implemented different trainings around for professionals who work with children and youth. So this could be for police officers or law enforcement, first responders. It could be for counselors. It could be for childcare workers and teachers. And a lot of the trainings were kind of Children's Exposure to Violence 101, and here's what you need to know. And other trainings were more focused on here are different kinds of trauma-informed treatment programs that you could offer at your organization, or even more specific on, we're going to really focus on this type of treatment and healing program. So those were the professional trainings. And then finally, sites chose different strategies that we kind of captured under system infrastructure, in which was changing the way that the community responded to children's exposure to violence. So whether it was looking at law enforcement, and if a law enforcement official went out for instance, a domestic violence call, making note on their form about whether a child was present during the incident, streamlining the way all the different organizations in the community work together, ways that a whole county can screen and assess children. So those were just some examples of different system infrastructure. So as I said, each site did a community needs assessment in late 2010 and early 2011, and figured out what their community, what the greatest needs were in their community, where were the gaps in service, what was the most common form of violence that they wanted to address. And from that, they chose different strategies to address those forms of violence and to fill those gaps in services. So each site chose a bunch of different strategies, but some of them were their primary focus and some of them were their secondary focus. So as when I was talking about prevention programming, I said that some sites did targeted prevention, but the reach might not have been as large. So maybe they funded a local community organization to implement a smaller prevention programming for maybe 20 families. So in that case, it wouldn't have been a primary focus of their initiative. It would have been a secondary focus. So this table here kind of maps out the different focuses for the different sites. So for instance, in Grand Forks, I mentioned that they were able to work with the local school districts to get prevention programming in kindergarten through 12th grade. So obviously that was a primary focus for them, as well as community awareness. They did fund some local organizations that did treatment and healing programs. They were able to have one organization hire an additional therapist, but it wasn't the focus of so some of their monies did go to that, but it wasn't the primary focus of their initiative. Okay, so I'm going to focus in a little bit more heavily on a couple of the site strategies that might be relevant to the work that you guys are doing now. So that's going to be the screening and assessment, treatment and healing, and professional training. So I'm just going to go back for 1 second. As you can see, the sites had different focuses. Each of these sites, when we did our process evaluations, has their own individual report that documents everything that they did and all of the challenges and the successes. And it's kind of a blueprint for anybody who else might be interested in doing something similar in their community. So I would say at the end of the report, at the end of this presentation, there will be a link to those reports. So if any of these things that I'm not going to talk about, for instance, prevention programming, might be interesting for you for another reason, not maybe for the project that you're working on now, you could go, for instance, to the Grand Forks report and learn more about that. Okay, so screening and assessment. As I said before, screening refers to how children are identified for potential intervention, treatment, and healing programs. Some of the sites developed their own screener and assessment tools to do this. And I want to highlight one of those sites, which is Cuyahoga County. So as I mentioned, the big city there is Cleveland. Cuyahoga County developed a countywide universal screening and assessment model. This involved developing a universal screening tool. So in the Cuyahoga County report that is up on our website, I think it's Appendix A, you can actually find the different screening tools that they developed. They wanted to develop something that was very short, so not a full assessment, just 5 minutes long, 16 questions that can be asked very quickly by 2 primary county agencies that were the screening agencies. That was the juvenile court, so the Cuyahoga County Juvenile Court, and the Division of Children and Family Services. So places that are interacting with children on a regular basis and see lots of volume of children, so are able to screen many children in a short period of time. So as you can see here, in that just 2 years, they were able to screen over 16,000 young people. They developed 2 screening tools. One was for children 8 and older that was administered to the child themselves, and one was for children who were 7 years old and younger, and that was administered to the parent. The questions from the screening tool came from validated instruments such as the Juvenile Victimization Questionnaire, the Trauma Symptom Checklist for Children, the Violent Behavior Questionnaire, and the Child Behavior Checklist. And the researchers in Cuyahoga County looked at all of those and distilled it down to about 16 questions that they felt could capture whether or not somebody had been exposed to violence and is displaying trauma symptoms. So the screening happens, and then all of those who screen positively for having been exposed to violence get funneled to a central intake and assessment. So Cuyahoga County funded an organization that had a longstanding organization in the community that had done assessment with children who had been exposed to violence to be the central node where all of the children who had been screened positively would be sent for a full assessment. So this was a countywide initiative where everything got funneled to the central intake and assessment location where a full assessment was conducted. And then from that assessment, based on what was found, the young people were connected with appropriate evidence-based or promising practice treatment programs. So I want to say a little bit more some of the lessons learned about the screening and assessment process in Cuyahoga, because I know that's something that you guys might be interested in your communities. The way it worked was on these questionnaires, these screeners, if a child reached a certain threshold score, that meant they would be referred on to the central intake system. So that threshold score was decided on by the researchers and in conjunction with some of the treatment agencies. So the person administering the screener, so the juvenile court staff or the Department of Children and Family Services staff member, also had the discretion to override. So if a child didn't screen, but they really believed that this person needed services, they had the freedom to override and send the child on to central intake to have a full assessment done. There was also some automatic questions that if a child said yes to one of those, for instance, like a suicide ideation question, automatically got sent to central intake. So before anything got sent to central intake, the caregiver had to give consent. One of the great things about the Cuyahoga County model was that they were able to make the system electronic, because we know that the folks that are going out and doing the screening already have a lot on their plate. For them to do the paper copy of the screening and then have to go back to the office and do data entry, there could be a lag in time. There could be issues around data entry problems. So Cuyahoga felt it was really important to provide most of these screeners with tablets that they could do it online, and automatically the data would be entered into a database. And if a child screened positively and the parent had given consent, an email with that child's screener would automatically be sent to Central Intake and Assessment, and they could reach out within 24 hours to set up a full assessment for that child. So there were some challenges related to the screening process. So while it sounds like everything moved very smoothly, I just wanted to kind of flag a couple of things that might be challenging if you are interested in doing something like this, setting up a similar model. For DCFS, the point of screening was intake. And some of the DCFS staff members felt that that might not be the appropriate time to do a screening because parents might have had a case against them and were worried about answering honestly, and worried that maybe didn't answer honestly because they were worried about how an honest answer might affect their case. So that was an issue. So thinking through when is the best time for intake workers to do that screening and assessment. Setting the threshold level. Some staff members felt maybe we set the threshold level too high and we're missing some folks who might have been exposed to violence and trauma. But on the other hand, we have to be mindful of the capacity of our community. So if we can screen all of these people and we have X% having screened positively, but we can only have the capacity to serve a certain amount of them, just the ethics behind that and thinking through that, the lack of capacity of treatment options. So those were just two of the big challenges to doing screening and assessment. The electronic model was a way that they felt they could overcome some of the other challenges related to the data entry, potential data entry error, and as well as confidentiality issues if you were to fax a screener over to the central intake, and if it's sitting on a fax machine even if it's sitting there for 5 minutes, somebody could see it and see some confidential information. Okay, so once a child has been screened and assessed, if necessary, they've been connected with appropriate treatment and healing programs. Each site chose different evidence-based or promising treatment programs to connect their young people with. Most of the sites did. The most common treatment program was trauma-focused cognitive behavioral therapy, TFCBT, but other ones were such things as parent-child interaction therapy, SPARCS. So those were once a child had been screened and assessed, and an appropriate intervention for treatment and healing they were connected with an appropriate intervention. That could be some sites funded specific organizations for specific treatments. So they might have funded a local organization for TFCBT and funded another organization for SPARCS and another organization for parent-child interaction therapy, or they might have funded one organization that could do all three. So because some of these organizations didn't have capacity previously, they offered a lot of training on these different treatment and intervention programs. At the tribal site, so on the Rocky Boy and the Rosebud, they often chose different cultural activities to heal the trauma. So for instance, both of those sites use sweat lodges and spiritual practices such as smudging and prayers to address trauma. Some of the challenges surrounding treatment and healing programs was a lot of these evidence-based programs are very long and require a lot of work on behalf of both the child and sometimes the parent as well. So we found that the dropout rate is often high because these programs have evidence behind them showing that if a child completes, there is, for instance, a reduction in trauma symptoms. When you have a large dropout rate, you may be offering them these evidence-based programs, but if they're not receiving the full dosage, you can't expect to see the same results, positive results. So it just spoke to a need to develop reefer treatment options because many of the kids who have been exposed to violence are also, going through different systems, foster care system, criminal justice system, dealing with concentrated poverty and the issues that come along with that. And sometimes it's difficult for them to be engaged for maybe potentially months that it might need to finish one of these treatment programs. There was also another challenge was that in these sites, direct service staff turnover is very high. So you may train people on these, for instance, TFCBT or SPARCS, but working with children who have been exposed to violence is very draining, and oftentimes there's high staff turnover because of that. So that means there's a need for continuous training, one for new staff that come on, and two for different new treatments, and three for booster trainings for the people who have done the original training, just to keep them engaged with perhaps new literature that has come out, and just to remind them of different things, because sometimes they might be trained in one of the treatment programs that might be, for instance, PCIT, but a lot of the referrals are coming for TFCBT, so it might be a while, large spaces of time before they actually do PCIT, so they might need some booster trainings. Okay, I'm going to turn it over to Lama to talk a little bit about the professional trainings that the sites did.
Hi, everyone. I'm going to talk about professional training, and then we're going to dive into lessons learned right after. So all of the sites offered some kind of professional training to local professionals at their sites. These trainings were either very short, maybe an hour or 2-hour trainings that were things like Trauma 101 or Children's Exposure to Violence 101, or they could have been longer multi-day trainings, and I'll talk a little bit more about this, and in some cases, especially in Boston, they did long-term training models that consisted of a training commitment for more than a year. The topics varied by site, but included things like the effects of trauma on children, resiliency, what trauma-informed care is, how to keep data confidential across different agencies and different systems. To hone in on the Boston model, in Boston, and this is a particularly interesting model, they adapted the NCTSN's learning communities and collaboratives model and held 3 learning communities for TFCBT, which Rachel just mentioned, for CPP, which is child-parent psychotherapy, and for ARC, which is attachment, self-regulation, and care. And so these learning communities were 18-month commitments originally for the agencies and the clinicians that decided to participate. And they really provided an in-depth training and ongoing consultation. And so over the period of 18 months, the clinicians that were part of the training held monthly consultation calls and had additional in-person trainings. And the consultation calls were aimed at them sort of talking through their experiences with applying the treatment. So whether it was TFCBT or CPP or whatever the topic was, they talked through on a monthly basis all the challenges and successes with applying that, and kept learning throughout the course of the 18 months. Boston also had a breakthrough series learning collaborative, which was aimed less at individual clinicians and more at creating trauma-informed organizations. And so for this learning collaborative, which was also originally was a 12-month commitment and they extended it to 18 months, an entire organization signed up and sent about 5 to 6 representatives that were engaged over the course of the 18 months. And the aim was to transform their organization into a trauma-informed organization where being trauma-informed was part of everything they did. Their first Breakthrough Series Learning Collaborative focused on early childhood centers, and they had 6 centers signed up, and that made it through the training. And so they trained them on how to make small changes to eventually become fully trauma-informed. And the small changes were really in every aspect of their work, For example, how do we greet children when they come into the center with their parents in the morning, all the way through how to handle discipline, how to work with parents, how to work with your local community from a trauma-informed perspective. So these long-term training models have an advantage in that they are not one and done. The people who go through them, whether it's clinicians or organizations, for the Breakthrough Series Learning Collaborative, which was organization, but had a parent representative, for example, that was part of it for the full 12 to 18 months. Whoever goes through them gets a real in-depth understanding of the treatment or the topic they're being trained on, and it creates change within those organizations much more than sort of the one-day or half-day training topics. The challenge with these long-term training models is that they tend to they simply engage less people. There aren't hundreds of people involved in it because it would become a little bit difficult to manage, and so the clinician learning communities had maybe 20 to 30 participants at a time. And like I said, the Breakthrough Series Learning Collaborative, the first one had 6 organizations. Each organization had 5 representatives. And so they engage less people, but they create a more sustainable training approach. Okay, so we're gonna talk now about lessons learned. Do we want to stop here and take some questions because it's been a while? Do we have any questions, or do people want to type in their questions quickly right now about this first part before we move into lessons learned?
Nikki has typed, I'm curious how Cleveland was able to obtain buy-in for the assessment tool. How did they manage to implement it for the whole county?
Okay. Hi, this is Rachel. Great question. So the assessment tool is different than the screening tool. So what they really needed to do was get buy-in on the screening tool from the juvenile court and from DCFS. Cuyahoga County has a long-standing history of collaboration around children's exposure to violence. They had previously had a program called Children Who Witness Violence. So a lot of these players had been working together for well over a decade before the Defending Childhood Initiative came about. So the players were kind of used to working together around this issue. And when this opportunity came up, at first, indeed, I think the people in charge at, for instance, the juvenile court or DCFS thought it was a great idea. The people who really needed to get the buy-on from was the people who were going out into the homes and actually doing the screener, because they already felt taxed on what they had to do. So I think that was really just that came from the top of the organizations of saying this is a new way of doing things. Providing them with the tablets to kind of decrease extra work that it was going to create was also something that was very helpful. Like I said, it was still very much a challenge, though, because, for instance, if somebody had multiple children in the home, a screener needed to be done with each of those children. And the parents got annoyed, the line staff got annoyed. So it was definitely something that was challenging. The assessment tool, but that said, because of that longstanding history, all of the organizations, the leaders of those organizations were already on board and kind of said, this is going to be our new way of doing things. The assessment tool was actually something that had been created under a SAMHSA grant that Mental Health Services, then changed their name to Frontline Services, the organization in Cleveland that had gotten the grant to become the central intake, was something that they had been using for a while and referring out based on that assessment tool. So it wasn't something new, and everyone in all of the major treatment organizations in the community already knew about it and had been working with it for a while. Hope that answers your question. Okay, Carlene, I see your question about other protocols publication that you can share with the group about developing in a screener. So actually on our website, there is, yes, on our website, there is actually a podcast done with our communications team with the project director, Jill and with one of the lead researchers, Jeff Kretschmar, about the screener and about their program. So you can learn more, definitely, if you take a listen to that podcast. Yes, and the data for the screeners were being entered. It wasn't an iPad, but it was a tablet. Just some other folks are typing in questions, so I just want to give a minute for that. Okay, so then somebody had a question about were the screenings done in the homes, and was money used to create a new system or did that currently exist? So the majority of the screening was done in the home. There were or at the court, there were a couple of other agencies that signed on to say anybody who comes through our organization, we're also going to screen them. So some of those were treatment organizations that maybe weren't funded to do any of the treatment, but really wanted to be a part of the initiative and really believed in the mission and the strategy of the screening and then the centralized assessment. So some of those screeners weren't actually done in the home. They were actually done at those organizations when a child came through. So there was money. Each site kind of like they did this community needs assessment and figured out where there were gaps and what needs that they wanted to fill and what activities that they wanted to design. Similarly, different sites said, okay, here's what we're going to do. We're going to give X% of the amount of money of our grant to go towards community awareness and education, Y% towards treatment and healing. And for instance, in Cleveland, they chose to do some amount towards screening and assessment. So that wasn't actually already in place. The screening development, some of the money that they chose to allocate was actually towards research. So they funded some folks at the Begun Center for Violence Prevention at Case Western University to be the local evaluators on the project, but as well as help develop this screener, because they are all psychologists who have years of experience on doing research related to children's exposure to violence. So they had some money to do that. The electronic system was actually something that they got money from their school, from Case Western, to develop. And it wasn't actually a part of the grant, but they knew that it would make everybody's lives easier if they were able to do that. So they were able to get some additional funding. Yes, so most of the other question were, most of the children who were screened were involved with the court system or with the Department of Children and Family Services.
Okay, so maybe let's move on to lessons learned, and we'll take questions again at the end. Thank you for your questions so far. They were really great. So lessons learned. So this is really lessons learned across sites, and I'm going to start by talking about the collaborative bodies at the different sites. So this table provides an overview of each site and how many organizations were involved in their collaborative bodies, and for some of the sites it shows their subcommittee structure. And so as you can see, especially with the sort of the larger open urban sites, they had many organizations. In Boston, they had 65 organizations. In Cuyahoga County, they had 60 organizations. And these organizations for the collaboratives were ranged from governmental organizations and governmental partners like the local police, the local court system, to local and community-based nonprofits who were doing a lot of the field work in terms of addressing children's exposure to violence. In Grand Forks, they had about 40 organizations. The two tribal sites were smaller, with 12 and 9 organizations respectively, and Shelby County had 30 organizations in its collaborative body. Even though Boston was probably officially the largest, they didn't have a formal subcommittee structure. What they did was ad hoc subcommittees based on the current project or the current topic. And so, for example, when they decided to fund local community health centers to do treatment and healing, they put together an ad hoc committee that selected the community health centers through an RFP process. And so anyone from their collaborative body was allowed to participate in that, whoever was interested. But obviously not everyone did. And so it was the organizations that were sort of most engaged in that component. And simultaneously, when they had a community, when they pulled together their big community awareness campaign, again, they asked for a subcommittee, a volunteer subcommittee from their collaborative body members that probably differed in its composition than the one for the community health centers. In Cuyahoga County, they had six formal subcommittees that each sort of took on its own niche area and tasks, but obviously the collaborative body also met regularly. The same thing happened in Grand Forks and Shelby County. They're all very different. Everyone took different approaches, but this table just sort of summarizes them for you all. It's also available in our report if you look that up later. So the collaborative bodies aim to cut across silos, and for some of these agencies, they hadn't really collaborated in the past, even in cities like Boston where there's a lot of cross-agency collaboration. For example, domestic violence or organizations that try to address domestic violence hadn't worked very closely with organizations that try to address community or gun violence. And so it really cut across silos and helped people think outside the box in terms of addressing violence in their communities overall. Some of the collaborative bodies included youth and parent representatives, and those usually came through organizations. So, for example, Start Strong had youth representatives on some collaboratives in some of the sites, and there were some sites had local parent advocacy organizations that participated in the collaborative. Some of the challenges, as you probably know, if you have any experience with these kinds of initiatives, is collaborative fatigue. Just that a lot of the people who participate in collaboratives are participating on a lot of sort of collaborative efforts and initiatives that are happening in their city or their county or their state, and so they tend to get tired. I don't think there's any other way to put it. The other thing to keep in mind is also that it's hard to keep organizations engaged when they don't receive funding. So you might initially have a lot of organizations on board because they know that you'll eventually be funding people to do treatment and people to do community awareness. But then once all that money is doled out and you're in the middle of implementation, it's really hard to keep those organizations that didn't get any funding engaged and coming to collaborative body meetings and having their voice represented in those meetings. So that's just an important consideration for collaborative bodies. The other thing I should say about collaborative bodies is that many of the collaboratives for defending childhood focused on doing consensus decision making, and that has its own challenges. Rachel's going to touch on this a little bit later. But obviously it takes more time and a lot more work when you want to reach consensus about all the different strategies that your collaborative is going to pursue. So another important, another set of lessons learned are around sort of the urban-rural divide. In every, some of the sites for defending childhood were clearly big cities. And others had a lot of rural areas, and rural locations have unique challenges to them. They're spread out. It's hard to raise awareness in these areas. It's hard to reach people. And even if you reach people, it's hard. People have more challenges. Sometimes have more challenges in terms of accessing services. Rural sites also felt a little bit left out of the national dialogue. A lot of what we talk about nationally when we talk about children's exposure to violence focuses on urban areas and urban problems, and rural areas have different problems. A good example is Grand Forks. You know, in terms of their needs assessment, one of the big things that came out was school-based violence and bullying. And although that was important in many of the sites, it wasn't as important as it was in Grand Forks. The rural sites also need more intensive technical assistance, or maybe it's not more intensive, but they tend to need just slightly different technical assistance and have different needs than urban sites. Site visits, even our site visits or the TA provider site visits tend to take longer because everything's very spread out. And tribal communities are usually rural or frontier, and they also have unique opportunities and challenges. As some of you know, we're going to be doing a separate webinar about tribal communities and the lessons learned and recommendations for those specifically. But it's just important to keep in mind that they also generally fall under the rural, although there are some urban tribal communities. So local politics. So I think it's important to just be mindful of local politics. Those of you who worked in this field, or really any field that engages government for a long time, knows that politics can either be a barrier or a facilitator. For the Defending Childhood sites, many of the sites had local political champions that helped create buy-in and engage government agencies and other agencies that may not have been engaged otherwise. Simultaneously, other sites where there wasn't as much political will faced significant challenges in terms of getting the initiative to move into implementation because of the politics. This is true both for rural areas and urban areas. It's true for tribal sites and non-tribal sites. It's really important to be mindful of local politics. There are other ways that politics can influence things, or actually government can influence things too, in terms of, for example, in Boston, they could only hire people who lived in the city of Boston, which is actually not that large of an area, and so that proved to be a challenge in terms of hiring people. So it's important to keep all of that stuff in mind. The political transition is also important to prepare for and recognize that it's going to take time. Even when you have new leaders who might be supportive of your efforts, it takes time to tell them, to sort of just inform them about where you are and create additional support. So that's just another important consideration related to politics. And there's always political transition. So we're going to move into recommendations next, and I'm going to turn this back over to Rachel.
So for each site, we did a process evaluation report. So if there's something that's interesting to you, for instance, the Boston professional training model, you might want to go to the Boston report. For the Cleveland model, you might want to go to the Cleveland if you're interested in prevention, the Grand Forks. But we did do one report that kind of was like a cross-site report that synthesized different lessons learned across the sites, as well as provided, I believe it was 59 recommendations for different folks. So for practitioners or jurisdictions that are interested in implementing either children's exposure to violence programming or a large-scale collaborative initiative across a jurisdiction, because some of the recommendations and the findings aren't necessarily just specific for children's exposure to violence programming, but any kind of large-scale initiative. There were recommendations for other tribal communities. There are recommendations for funders, so both federal funders as well as private foundations, And finally, recommendations for technical assistance providers and for researchers. So you can find all of those in our cross-site report. And we're just going to highlight a couple. Yeah, we're just going to highlight a couple now for other jurisdictions. So we won't focus on any of the funding or the researcher recommendations. So, and we kind of grouped them as recommendations at the start of the initiative, recommendations for when you're actually you're in the implementation phase, and recommendations for thinking about sustainability and what might happen after your funding runs out. So recommendations for the start of the initiative, you want to carefully weigh the benefits and drawbacks of geographic targeting. So we had some sites that said the violence is concentrated in these 2 communities. We're going to focus all of our work in those 2 communities versus we're going to, address violence throughout the community, because maybe community violence is visible and comes up in those police numbers or those court numbers, but there are other types of violence that might not be shown, maybe teen dating violence or bullying or domestic violence that might not come if you mapped violence in your community. So thinking through, we could reach everybody and maybe give everybody a little bit of programming. If we target the whole community, we could concentrate resources in places that we feel need it most, and really maybe have a deep effect there because we're able to give more program. So just thinking through the pros and cons of doing that. Lama mentioned it when she was talking about collaborative bodies, but when possible, using consensus to make decisions works really well. And it's not always possible because of time limitations, but that structure for the sites that used consensus, for instance, in Cuyahoga County, made people stay on board longer. So even if my organization, I was a member of the collaborative body and it didn't get funded, everything was transparent and I understood how the decision and the funding decisions were made, and I'm more likely to say I still want to participate because everything was transparent and everybody's voice was heard. One of the other recommendations is, this is for at the start of the initiative and as well as during implementation, but particularly at the start of the initiative, you want to have researchers on board. You want to make data-driven decisions, whether it's related to targeting, whether it's related to types of activities that you're going to offer and focus on, and how we're going to evaluate whether any of these were effective, what was the change in participants because they came through the program. You want to be able to capture baseline information. You want to have researchers involved very early on. You want to fully understand overlapping initiatives. So Lama also mentioned this collaborative fatigue where the players who are on the Early Childhood Education Collaborative might also be on the Children's Exposure to Violence Collaborative, might also be on the Teen Pregnancy Prevention Collaborative. You might start seeing the same players. You might have a violence initiative that's related to community violence and they're giving out one message, and then your initiative is related to children's exposure to violence, and maybe you're telling people to call a different number if they suspect somebody needs help. So you really want to understand all of these overlapping initiatives. One, to see where you can create synergy and figure out not overlapping efforts and not burning people out on the collaborative, as well as making sure that you're giving one message and not confusing the community with saying, hey, are you saying to call here or are you saying to call here? One of the other recommendations that was heard from, basically a lot of these recommendations came directly from the sites themselves, was budget for an administrative assistant, especially during the implementation phase. You are going to have to provide data and provide data on what you're doing and information on what you're doing to your funder, to your technical assistance provider, to your evaluator. If you decide to then in turn take some of the money that you've received and fund bring it into the community and fund local community organizations, you're going to find yourself as a grant, not just a grant recipient, but a grant administrator, and that comes along, that brings along a lot of other administrative tasks. So early on, I would say if you're developing budgets, definitely budget for an administrative assistant, so your project director isn't pulled in all these different directions, dealing with responding to requests from different important players, but and can really focus their time and their energy on implementation. It's also really helpful, we found in the Defending Childhood Initiative, to create a classification system to organize types of programming so everyone kind of understood these are the things that are prevention programming or these are professional trainings. And that helped also to kind of help the sites to learn from each other, because they were saying, you know, oh, I'm classifying this as prevention and you're classifying this as prevention, and what were your lessons learned and how can we help each other? But it also helps for giving an external narrative to talk to your funders about, and to talk to, if you're promoting in your community or to your local politicians or anything, it provides a concrete structure through which to discuss your programming. And then obviously you want to plan for sustainability, because even right at the start, because grant funding is limited and there are trends in funding decisions, and something that might be trending now might not be trending in 5 years, and you want to, that doesn't mean that, for instance, children's exposure to violence is no longer important, but you just want to plan to how to maintain that programming even after the funding ends, and starting it from the very beginning. So recommendations for while implementation is happening, especially in some of the rural areas, there were transportation obstacles. So offering home-based services to help overcome those transportation obstacles. It might take somebody an hour to get to a local social service organization, and they might not have means to do that. But this is also true in urban areas. Even in sites that have good public transportation systems, people might not have money to use the bus system or to use the subway system. So you going to their home and meeting them there or their school helps overcome some of those transportation obstacles. I'm just going to skip around a little bit here. Focus on the positive. So this really came out a lot of the prevention programming of young people. You know, you don't want to constantly bombard them with don't do this, this is bad, this is bad. But you know, what do we want our community to look like? What does a Cleveland without violence look like? What do positive friendships look like? What does it mean to be in a healthy relationship? So also focusing on that, as opposed to not always just focusing on the negative and what not to do. This beware of mission creep is really important as well. Like I said, there are lots of overlapping initiatives and same players who are on different things. And then so you don't want to kind of get off the mission of your topic, as well as you're going to find that a lot of the people in the Defending Childhood Initiative, as I mentioned before, a lot of the people who had been exposed to violence were also victims of poverty and unemployment, and they're coming with other needs. So maybe their primary need isn't just let me get treatment for the trauma that my child is experiencing, but really, like, you know, I don't even want to think about doing that until I can pay my rent or my electric bill. And then you might start finding that your organization is kind of, there's some mission creep there of, okay, well, obviously we have to address these other needs before we can ever address the trauma exposure. And then you might find that a majority of your programming slowly gets to a majority of your programming is dealing with those other needs and not the actual goal of the program. Finally, you want to look for ways to leverage existing resources in the community. You might have other collaboratives that are there that you might fold your collaborative into. There might be other, so this can kind of be broad, or it can be even just small. For instance, in Shelby County, they received a donation of flash drives from somewhere. So they were like, hey, we can load all of our resources about children's exposure to violence on these flash drives and give them out to our local community organizations so that they always have the information there. So that was just one way that they were able to, leverage existing resources. In Grand Forks, they knew that if they bought a bus wrap, which is on their local public transportation system, there are buses. They don't have trains, and a bus wrap is kind of like an advertisement that goes around the bus. And they created one for their local Defending Childhood Initiative, which is called Safer Tomorrows. And they knew that not many people buy those bus wraps, so you pay for 6 months, but you actually get about 2 years because nobody's buying the bus wraps, so they don't change them. So just looking for ways to leverage existing resources in your community. And then finally, other jurisdictions want to plan for sustainability, as I mentioned, starting early on, but thinking about recommendations specifically regarding sustainability. You want to plan for unintended consequences, and this happens on a couple different levels. So for example, there are always going to be unintended consequences. So as in, you have a large initiative trying to reduce the number of children who have been exposed to violence. And now you implement a new screening system that is screening 16,000 people in 2 years that never would have been screened. And all of a sudden your numbers of children exposed to violence increase. This isn't necessarily because there's been an increase in children exposed to violence, but you've expanded the capacity to screen. So thinking through, how does this look for future funding when we say, look, we did all of this, but what are the numbers saying? So that's just an example of unintended consequence, and you want to think through that. You want to promote institutional adoption of best practices. So rather than, Lama said, the one and done type trainings that for specific individuals, that if there's staff turnover, you had just put a lot of money into training these people who have now gone off for other things. And that's sometimes for multiple reasons. Sometimes it's because it's hard work to work with these young people who have been exposed to violence, and it's very draining. It's also because when you know a position is grant funded and it's finite, you might take the job, but then say, oh, I only have 1 more year left on this job, I might start looking for another position. So you've poured all your resources into training this one specific individual who then may leave. So therefore, you might want to consider, for the sake of sustainability, targeting agencies rather than specific individuals that you train once and then they leave. So thinking through, okay, what are the different changes that we can ask agencies to make and institutionalize? That way, even after our program is done, even after we can't train any more individuals, those best practices keep on moving forward. And then finally, focus on systems-wide change. So for some of those systemic changes we talked about in the beginning, so maybe if early on we're focusing on getting a checkbox onto a police report, even when we're no longer, the defending childhood isn't going on anymore, that checkbox is still on the police report, and it's changed the way the police might handle children's exposure to violence. So you want to focus on some things on what can be sustained after our funding runs out or after our initiative is over. So let's concentrate some resources on making those system-wide change. That way, when we're done, those changes still move forward.
Okay, so I'm gonna wrap up with this with a couple more slides, and I'll try to go through these quickly so we still have time for questions at the end. So these are just some other important considerations that sort of came out of our other recommendations and lessons learned that we wanted to highlight for this audience. First of all, it's important to keep in mind the federal approval processes for public messaging, because currently, I think you're all working with DOJ funding. It's actually a long process to get your publications approved for dissemination, and so it's really important to keep that in mind. It's possible that over time that process will get shorter with DOJ, but I can't guarantee that. So just keep in mind that if you create a pamphlet or a brochure or an ad or anything that has a public message, it needs to be reviewed, and that review process takes time. You can't release it the next day. There's a lot of partners involved in these large-scale initiatives. There's a TA provider, there's a funder, there's a national evaluation team, and then you might bring in your own evaluation team. And so it's the coordination amongst key partners is very important. As the sites had to do a lot of balancing between the different demands. The TA provider would ask them for something, the federal funder would ask them for something else, and our evaluation team would be asking them for other types of information. And the information might not overlap. We all have different needs and are using the information in different ways. And so Rachel mentioned before hiring an administrative assistant, but just making sure you're cognizant of all the different requirements and demands and forms and things you need to fill out is really important, because those things tend to become time consuming. And also this goes along with managing site visits from the different partners who want to visit you. It's often really useful to schedule different site visits simultaneously. For example, we did several site visits along with the TA provider. So the evaluation team doing a site visit with the TA provider, where they can both observe what's going on, learn, do interviews with people, and sort of achieve the same goals in one site visit rather than multiple. And also in terms of working with your TA provider during the implementation stage, I think it's important to focus on the science of implementation early on, right at the beginning, so that you get all the information about how, sort of best practices and what's the best way to implement things before implementation starts, and to keep that in mind. And also, once implementation does start, your needs change in terms of the type of information you'll want from TA and the type of engagement, and just to constantly inform your TA provider of what your needs are, and just have open conversations about that. So this is the website for our General Defending Childhood page. Just from that page, we have a lot of reports on that page. We have the cross-site report as well as the 6 different site reports. I'm highlighting the Cuyahoga report because we think it's of particular interest to you all. And then also the tribal site reports, Rosebud and Rocky Boy, for those who have tribal communities. You can also read any of the others, or you could start with the cross-site report, and sort of the information in there is expanded on in the individual sites, and you could go to each site as needed. And I guess that's it. We're happy to take questions or comments, and Rachel's email is up here too if you want to send your questions on later, if you think of things later.
I just want to thank everybody for joining us today, and thank you to NCJ, FCJ for hosting this and setting this up.
Thank you, Lama and Rachel, so much for this wonderful information. We really, really appreciate it. And as Lama and Rachel shared, on October 7th, we are planning a follow-up webinar to this webinar that is tribal specific. So if you're interested, please join us. We'll be sending out that information shortly. And at the end of the webinar, you'll have a survey, a very quick 3 or 4 question survey. We would really appreciate any feedback you have for the webinar. So Nikki has a question here. First of all, she says it's very informative. Thanks so much. Her question is, how does the site deal with mission creep, attending to the basic needs of families? Oh, so families can focus on trauma is a huge issue for us. And Nikki is in Montana. Thoughts on how to address it while staying in the boundaries of our project, and any recommendations based on experience?
So this is Lama. I think the sites really struggled with this, and they identified this as an issue in our site visits, and I don't think there's really any easy answer for it. Regardless of what topic area your initiative is about, this tends to happen because so much of what people are working on is just related to things like poverty and unemployment. And so I think it's definitely a challenge. Some of the sites did have referral processes to other organizations who handled sort of these other issues, or they just had those organizations sitting on their collaborative bodies, and so those organizations were really part of the process all along. For example, a good example is Rocky Boys Reservation in Montana. That was a site for this study, and on the reservation they had their They had their TANF program, people on the collaborative body, and those people really helped help their advocates and their case managers with addressing people's needs that were beyond the immediate children's exposure to violence needs. But it's definitely not something easy to handle. I don't know if you want to add anything.
Yeah, I mean, I think that this is an excellent question, and I think it's something that all of the sites struggled with, and I don't think anybody came to a way to address it, except for the sites that didn't need to struggle with it because they focused maybe on the screening and assessment component, or but the sites who especially did like case management and people coming to them and saying, you know, like we know this person's been exposed to violence, but they don't have, you know, their kid can't go to school because they don't have clothes or they don't have food or they don't have this. A lot of the sites just did start addressing those issues. So I think it's something that they struggled with, and said like, well, we could never really address those issues unless we can't address the trauma and the violence issues unless we address these basic needs first. And I think it speaks to the importance of longer term programs and relationships, because a lot of times also somebody won't disclose violence, specifically like maybe like domestic violence, until they have a relationship and they feel like this person, I trust this person because they've helped me in X, Y, and Z ways related to some of my basic needs, and then you get to that. So I think it speaks to, I don't think we have any kind of, here are the best practices and how to not deal with those other issues, but you know, and not have mission creep. But I also think it speaks to the importance of funding for funders to really understand the different problems that are interrelated and the need to have some flexibility in addressing them.
I'll just add that in Boston, they funded 2 community health centers to do treatment, and part of that funding was hiring clinicians. But they hired the clinicians, and this is based on their collaborative body, what their collaborative body recommended. They hired the clinicians in partnership with what they called a family partner. And so people would go to get children and their parents would go to get treatment from the clinician, but the clinician didn't have to worry about any of the other needs of the family, because the family partner's role was really to partner the families with other agencies to get them things like WIC and other services that they might need that were not related to their trauma, with the aim of having that person sort of alleviate some of their needs so that the clinician could do their clinical work. So that's that still doesn't address it, because they're still funding work that's not directly related to children's exposure to violence or trauma, but it's just one way where they were trying to manage both. Yes, we agree.
Well, thank you everybody again for joining us today.
All right, thank you everyone. Have a great day, and look for information regarding the follow-up webinar on October 7th. Thank you.
Thanks.